I have the great pleasure of introducing this session, Support Workers on Your Team on Placement and in Practice. My name is Mary-Therese MacDonald and I'm a professional advisor here at the CSP. So, support workers make significant contributions to patient care and valuable contributions to pre-registration education through supporting physiotherapy placements for learners. Support workers also contribute to the learning of registered colleagues. For support workers to effectively contribute to practice-based learning, there must be investment in the support workers' own learning and development to ensure that they can undertake this part of their role confidently and successfully. To hear about the significant role of support workers on your team on placement and in practice, I am introducing three speakers. First, we'll hear from Rob Minter. Rob is a therapy assistant at Hull University Teaching Hospital. Rob will talk about his role as a support worker and also his role in practice education. We will then hear from Laura Lister. She is a lecturer in physiotherapy from the University of Hull, and Laura will talk about support worker education training and how student learners learn about support workers within the curriculum. We'll then hear from Millie Marsh, a third-year physiotherapy student from the University of Hull, around her valuable contributions support workers can make on placement from a student perspective. We will then have some time for questions, hopefully. So many thanks for our speakers for joining us in all their preparation today. So I'll hand over to Rob. Thank you.
Thank you for that. Perfect. As MT said, I'm Rob Minter. I'm a therapy assistant at the Hull University Teaching Hospitals. A role I've been doing for nearly 10 years, so February will be my 10 years in that role. I started as a Band 2 member of staff because I was working security to begin with. I was on bed watch, and I thought I wanted to be a part of the bigger, wider NHS world. I was briefly a Band 5 AHP support workforce lead in my trust, which was a 6-month secondment where I was looking at the workforce retention and planning for our support workers for the future. I've also been very active within the CSP. I'm currently the Vice Chair going on to become the Chair of the Associates Network. I'm the Yorkshire and Humber Regional Network Chair. I'm a workplace steward and also the JNCC staff side chair. I'm also on the ARC Agenda Committee, so in other words, I'm very greedy with all my roles. So, awards, I'll briefly say I've had 2 awards. In 2022, I got a local AHP Support Worker Award for raising the profile of support workers, which I'm more than happy to do. I just think it's part of my job to do that. In 2023, I was nominated for Volunteer of the Award for the CSP. I didn't win, however, I was highly commended by the CSP. So, best thing to do is put your trust in us and time into us. So, during my time as a support worker, I have worked with loads of students. We have heard today a lot about different placements. But also, we have placements where the students come and shadow and work with us support workers. To begin with, I do the inductions, so I show the students around the department, give them the gym inductions, department inductions, making sure they understand even where the toilets are and the changing rooms are. But the students always have an opportunity to shadow with me and see what I do on a clinical side of things. Because you as students, when you become registered members of staff, you need to know what we do, so you can use us to the best of your ability. I have previously been what we class as a practice educator for first-year students, where they were shadowing in our department, and I was in charge of their timetable and making sure they understood where they need to be at what time, so we can be involved with student placements, very much so. And during this time, I did slip training, which helps me understand what I need to do to give the students the best sort of opportunities, really. At one point, I was told I couldn't countersign student notes, which I, being me, disagreed with. Because if the students are working within my scope of competence, they're saying I can't sign my own notes, which I'm signed off to do. So what we did with the trust is we worked and did an SOP. So as long as the students are working under my scope of competence, I'm allowed to countersign the notes. If the students decide to change the exercises or anything with the patient's treatment, then I know I have to get that countersigned by a registered member of staff. But that's all within the SOP. I must admit, I have seen a great poster outside, which is discussing the HP support workers and being student educators. And I say, why not? We're more than capable. And as we need to get more student placements in the NHS, users. So, support workers, we are not scary. Honestly, we're not. We may look at the times, and we may be a bit grumpy, but we're really knowledgeable, and we're a constant presence in the area. So when you rotate round and come to different areas where the people that have always been there, we know what's going on in the department, and we're a fountain of knowledge, as I say. We know everything what's going on. We can also sometimes be a shoulder to cry on, or an ear to chew. And we can offer some really good advice and support when you need it. Just come to us. Just don't do it when we're busy. So sort of do's and don'ts from a support worker point of view. The sort of do's, talk to us, engage with us, use us to the best of our ability, trust us, involve us, but mostly respect us. I always say there's two forms of respect. I'll respect you because you've been to university and you've done your degree. But if you treat me like something you've scraped off the bottom of your shoe, I'm not going to help you very much, and you'll have to go and do things yourself. But you respect me, I will go to the ends of the earth and do everything in my power to help you. And I'm sure other support workers will say the same thing. Well, at least I hope so anyway. And just ask us questions. We're more than happy to answer, and we always say there's never such a thing as a stupid question, because if you don't know it, it's not stupid. So on the flip side, the sort of don'ts, don't upset us. We can get very grouchy. And using the words just and only in front of our title, so saying just an assistant or only an assistant will really irritate us. So try not to use that word. So don't ignore us and don't dismiss any concerns or ideas that we have, because sometimes we actually have really good ideas. And the thing is, I value working with students because they can teach me as much as I can teach them. And it is really good because you can bring so much knowledge to us and help us better ourselves. And I've learnt so much from working with students. And I'm so thankful that I get the opportunity to work with you guys. But even as a student, please delegate to us. That's what you're there for. And it gets you used to delegating support workers when you become registered members of staff. And when you're newly registered and you come work with support workers, make friends with us. Because honestly, it will make your job a million times easier if you've got your support workers on your side. And that's pretty much what I'm doing. So I'm going to hand over to Laura next.
Thanks, Rob. I've already been introduced. So I'm Laura. I'm one of the lecturers and the programme director for the University of Hull. Just want to say that we've had a really good representation from Hull today, so that's brilliant. So I'm just going to talk a little bit about the curriculum and our practice educator training that we do for support workers. So within our curriculum at the moment, we do talk about support workers and involve them in our practical sessions, in our simulated sessions. We'll delegate members of the MDT, and support workers would be very much roles that we would delegate within them. Or if we're doing case-based learning, obviously we talk about the roles of the support worker. We also talk about the different levels of an autonomy of support workers, which I'll come on to in a little bit more detail in the next few slides. I do think following this, so having this sort of talk that we're delivering today and discussing it within our teaching team, I think it has sort of enabled me to reflect on how much we do include support workers within the curriculum, so that's something that I do think we can expand on. Many of our students as well, as I'm sure on a lot of the programmes, are already support workers, so they already bring a lot of experiences and not a lot of knowledge and skills to the programme, which then they share with their peers. And a lot of our local trusts as well will actively try to employ the physiotherapy students so that they can work as support workers alongside their training. So all that really helps sort of develop the knowledge of support workers whilst physio students are doing the training. Our program's actually set up during COVID in 2020, so a lot of our training was online anyway, and our initial support worker training was online. But we did feel that perhaps the engagement wasn't as good as it could have been, so we do it face-to-face now. And our support worker educator training is very much oversubscribed, more so than the physio, when the registered physios come. So there's a lot of support workers out there really keen to get involved in supporting students, which is brilliant. So we look at what support workers want to gain from the sessions. So a lot of it's around how the course is structured. We just talk about what our students learn, what level they're at, what to expect from different students at different levels, a little bit around documentation standards, and I'll come on to that in a little bit more as well. Case studies as well, examples on students on placement. The feedback that we got from support workers is that they wanted more training around delivering feedback to students. On our programme, within the first year, in the first trimester, we send our students out on a 1-week observation placement just to familiarise the students with the clinical environment. And we do encourage support workers to lead that full session. So if they don't need a registered member of staff to support that placement on that 1-week placement, they're not getting assessed formally on that. So we do encourage local support workers to engage with that, and we do get really good uptake with that, which is really good. So the feedback that I got from support workers following the practice educator training sessions that we delivered, and I'm sure some of it probably echoes what Rob said as well, that the support workers do really enjoy having students on placement and do enjoy spending time with them, do enjoy learning from them and sharing their learning with them, and they want to do more of it as well. Students very much learn about their roles. So again, this made me reflect on sort of how we talk about support workers in terms of there's so many different levels and different roles of support workers now, isn't there? I know locally around the trust where we are, around the whole and East Riding, I'm sure it's similar across the whole of the UK in terms of band 2s right through to band 5s. There's so many different terms, isn't there, in terms of support workers. I think some places still use TI sort of terminology, assistants. We've got exercise practitioners. And I don't think we probably explained that enough in our curriculum. So I think some of that we could learn from and discuss a little bit more within the curriculum as well, but prepare students when they could do for going out into placement. And I think students as well are probably surprised at the level of autonomy that support workers have. Again, so that's something for us to reflect on and discuss a little bit more within the curriculum. Again, preparing students to go out into placement. But the support workers did say that overall they did feel that students did show really high levels of respect for support workers, but they were just surprised at their level of autonomy in certain roles. And again, they fed back that more advanced students had better delegation skills, so they were able to sort of see the differences between the levels of students that we have. And one of the things that really shone from their feedback was that students would often feel more comfortable speaking to the support workers, asking them questions, rather than going to their practice educator for certain things. Maybe they felt, less judgment from support workers. So they're a really good source of support for students on placement, and all that learning, all the skills and knowledge that the support workers have, I think really helps the students. And we did have some support workers as well that did come onto the training that had not had students before. So they were really keen to sort of learn about how they could support students. So a lot of the training was around, empowering them and giving them the confidence that you do have all these skills that you can share with our students, which was hopefully something that they took away as well. So I will hand you over to Millie, one of our third year students. Thank you.
Hi, I'm Millie. I'm one of the third year students at Hull. I'm also a therapy assistant as well. So I'm kind of just going to talk mostly about my experience as a student working with therapy assistants, but then also a little bit about my unique experience working as one and how I think it's benefited my practice so far. So these are some of the ways I think therapy assistants have helped me whilst on my acute placement, which was my second placement. I was in ICU and surgery. So number one, assisting patient handling to support safe practice. Therapy assistants do a lot of the moving and handling. They use a lot of the machinery, the hoists, the motor lifts and things, so they're really experienced with it. So they're great for helping me to use those machines and also do other patient moving and handling, such as things like toilet transfers, moving transfers, slide sheets, etc. The guidance and support to deal with situations of conflict. I've observed many situations, especially whilst in ICU, in surgery. It's very tense, very pressured environments. There's lots of sick people in there. There's lots of distressed families. And the therapy assistants do often tend to deal with that because they do see most of the patients every single day. They will be getting a lot of the sort of brunt from the family and friends, and they know how to deal with this conflict really well because they've done it so often. And it's great because as a younger person coming fresh from sixth form to university and then going out and practice as a physio, it's a little bit worrying to think about how am I supposed to relate with some of these families, some of these patients who will be a lot older than me and a lot different to me. And having a therapy assistant just to kind of observe, see what their behaviour they have and how they deal with it has been really good for my own practice. The ability to provide a continuous stream of feedback. I was very fortunate in that in my placement, on the first day, my first task was to do a STAIR assessment with a therapy assistant, and one of my last tasks at the end of the 6 weeks was to do another assessment with a therapy assistant, the same one. So they got to observe me for those whole 6 weeks, at least a couple times a week. So they knew what my baseline was, they knew where I was at the end, and even though they're not physiotherapists, they observe physios every single day. They know the skill set that's required of physios, and so they can observe them in myself, and they can tell me if I'm doing good, if I'm doing bad, if I need to change my communication. So it's just an extra source of feedback for me. And then lastly, the unique relationships to provide open learning opportunities. I think Rob and Laura both touched on this a little bit, but even though your educator may say, no question's a dumb question, come to me about anything, there's always still a little bit of anxiety about asking about something, or, if you need something clarifying, you may think, I don't know if I want to ask them this, they're going to grade me, should I know this? And there's none of that awkwardness with a therapy assistant. You feel very open to them. So I feel like I could come with them about any little thing. So they were just a great extra source. So these are some of the benefits I wrote. So improve moving and handling, improve confidence, promoting more reflective learning, and respecting a deeper level of understanding with these relationships. This is my experience with support workers in more of an outpatient setting, which was one of my last placements. This last placement was a frailty outpatients. So frail patients would come in and they would have a full top-to-toe head assessment from a physio, but also from a pharmacist, from a nurse or a medic. And the therapy assistant's role within this facility was they were often the first person the patient would see. They would be one that would greet them. They would often help move them to different rooms, so the doctor's room and the nurse's room and things. So they would do a lot of the soft skills, a lot of the moving and handling with them. So my soft skills definitely grew observing them in this outpatient setting. Again, I don't always know what to say to someone who's a lot older than me, and also because I haven't really worked before I become a physio, I don't really know a lot of the conversation starters, so they were just really great to kind of observe and to see what they do and copy it a little bit. And then also the wisdom and insight into the intricacies of healthcare. This is not something you typically learn while you're still a student. There's only so much you can do, and it's only once you're kind of thrust into the world of being a physio that you learn about all the different levels of care. You learn what level 3 rehabilitation is, or you learn the difference between the social care routes and why does this have this funding and this one doesn't have this funding. And the therapy assistants, especially the ones that have been in it for years and experience, they know all about it, so they can ask all these little questions, these little nitpicky things that you just don't really tend to have the knowledge, but you just gain. I've gained most of that sort of intricacy of healthcare knowledge from therapy assistants. So then, really quickly, what time are we? I will just say a little bit about what my adventures of working as a therapy assistant alongside doing physiotherapy has been. So I've been working as a therapy assistant since August of last year, and I've done over 400 hours of just working bank in a rehabilitation unit. And some of the ways I think it has helped me is, one, my confidence. because placements tend to be big stints apart, you have, you know, large periods of studying, 10 to 11 weeks and then 6 weeks of placement. It's been great because sometimes you kind of feel the nerves and anxiety building up to placement, almost like, oh, I have to speak to people again and I don't know how to do it. I have to be the practitioner again. But being a therapy assistant, working once, twice, 3 times a week, bank, I'm always talking to patients. That confidence is always there and it's always building, and it breaks down that anxiety of having to go from no placement for so long into placement, out of placement, into placement, having a constant stream of working in the NHS with patients. Teamwork, because I'm not a student, I'm actually a therapy assistant. I'm a colleague now. I feel like I'm more part of the team, and that gives me a better understanding of what it's like to work as a team within the NHS. Networking, I've had a lot of opportunities that I've gone for and also been given to me working as a therapy assistant. I've done extra shadowing of doctors, of GPs, I've done ACPs, AMPs, first contact practitioners. These were all just shadowing, not through uni, just through my job as a therapy assistant, which has helped my sort of university learning. Hands-on experience, again, all back to the moving and handling things. You know, I will do a lot of that as a therapy assistant. I even do things that you wouldn't do as a physio. You know, I do like kitchen assessments, and I do showering assessments, and I do toilet training and things. And they're all just really good knowledge and skills to have when you work as a physio, because you will find you doing those little bits that maybe are outside of your like prescribed role, but kind of within your like scope of practice. And then lastly, realistic expectations. So even though the physio and your educator that you work with does try to give you really realistic what it's like, you know, they may be a bit more chipper that day because they've got a student, or, you know, they may slow things down to explain it to you. Working as a therapist assistant and actually observing the physio, let me see what it's actually like to work as a physio. You know, some of the bits that are maybe not so nice, but that's given me a more whole-rounded experience of what it's going to be like when I'm a physio. So it makes me feel more confident to deal with the good things and the bad things. I think that's it. Yeah. Q&A. Thanks.
Thank you to all our speakers. That was really insightful. Thank you. And we have 7 minutes for questions, so can I invite any questions for our speakers, please?
Okay, hello, sorry. I'm from the Southeast, so I just thought I'd make a quick question because it seemed that there was a bit of differences in terms of how people refer to support workers. I know that within Rob's presentation, he was talking about support worker, but I believe, obviously in the last presentation, he talked about therapy assistant. Is there like clear defined distinctions between the roles, or is there like a standard in terms of protected terms and that side of things at all, or?
Is this on? Yep. So support worker is the sort of broad term for any people working in the HP profession. So that could be physio assistants, OT assistants, dietetic assistants, radiology assistants. That's the broader term. Obviously, roles within specific trusts. So, for instance, my actual job title is a therapy assistant. It used to be a physiotherapy assistant, but because we've now got like a blended role, I'm part physio, part OT, so it's now therapy assistant. But I know for other trusts around the country, you've got technical instructor, you've got therapy assistant practitioner, there's loads of different roles, and in AHP as a whole, there's over 230 different titles for support workers. So it's an absolute minefield. Yeah.
Hi, thanks. So as a support worker or a therapy assistant or whatever you want to call it, what do you see, probably more to yourself, of the development of support workers into therapists? What do you feel the steps are for that?
So I became a therapy assistant whilst working as a physio, but I also know there's a lot of people who have first worked as a therapy assistant and then gone into the physio. I think obviously there's the traditional route through sort of like, you know, sixth form, your A-levels, and then you go to university that way. But there's a lot of more mature students now that do, I'm not quite sure what the other route is that they come into it. It's like they do extra learning, don't they?
You could do
as
you mean
mature,
the MSc?
Yeah, like, you know, the mature students, once they don't go through the traditional A-level route, it's like the extra learning, though.
You can do the access to health.
Access to health, yeah.
Is that what you mean?
Yeah. So I know there's a lot of therapy assistants that I've worked with that are also saying they want to do things like physio, and they're doing the access to health. There's also the physiotherapy apprenticeship, which I don't think it's currently done at Hull at the moment. I know there's an OT one that I think is done. I know that there's talks about doing it, but that's sort of another route into there as well. Sorry, I'm not sure if that answered the question. I got away from it.
So there's probably more about how can therapy assistants develop if they're not necessarily going to do the qualification. Is there a route you feel that therapy assistants can still develop once they've kind of got to the top of the band, so to speak? Because I know you said you did something as a 5.
Yes, I did the HP support worker lead role, and my trust actually let me do the level 5 foundation degree. So it's not a full degree, but it was an apprenticeship, so I was working alongside doing it. So there is ways to give support workers more training and more development opportunities. And there's not many of the HP support work leads that were actually kept on after the initial 6 months, but there are some trusts that have them, and they're actually working really well. So if anybody's in trust, try and get your trust to get the level 5 and the band 5 support worker role, because it is massively useful.
For that role.
There are some job specs out there.
Thank you.
Within Rob's Trust as well, sorry, is that not on? Within Rob's Trust as well, they have band 5 exercise practitioners that they've been in post for quite a number of years now. So I think they do have to have a sports rehab degree or a sports therapy degree, or there's certain sports degrees that they have to have, but there is that opportunity to be a band 5 as an exercise practitioner as well. Yeah.
As a career in its own right, and so and the education pathways sit with it. But also for some support workers, they wish to go on to become a registered physiotherapist, and for them they become an apprentice learner. So there's a kind of 2 pathways really, isn't there? And so so for the higher support roles as well are important for support workers to move into them. So is that helpful? Yeah, absolutely, and also regional and countrywide as well. Thank you. Thanks for your question.
Yeah, so I would be the next one, if that's okay. So yeah, my question would go back to the, like, how do you manage your workload and all these different trainings of scopes that you have to get as a support worker? Because when I see the support worker's role or scope of practice and the things that they need to sign off, and then I looked at the list and I'm like, oh my God, this is like quite a huge amount. Like, how does this work? Like, do you get like constant training, or do you like how do you manage the workload and the patients that you have to see, and then the different training? Like, do you have time off for training, or like how does this work?
So yeah, I do get time off for training. So like for today and tomorrow, I've actually got study leave, which my trust has kindly given me. But a lot of it is I've got a really supportive team. So when I'm treating the patients, I'm having the peer reviews, and as long as the peer reviews are good, actually they go towards my competency and get signed off. So it's almost like a 2-in-1. So it's really useful that we have a really good learning environment. So it gets signed off really easily.
So then you can essentially get signed off just by, not just by like doing the job, and then they can see you, and then is that how it works?
Yeah, pretty much.
Sometimes.
Like, yeah, they said they just watch me in practice, and they link it with all the competencies, and they may ask a few different follow-on questions, either with the patient or once the patient finished with the patient. But generally, they're just linking it to all the competencies.
And
so it's like on-the-job training, really.
One more question. Sorry.
Yeah.
Who do you usually signs you off? Is it the lead one? Is it the lead AHP professional, or is it someone like a band 6 or a band 5, or who signs you off?
It can be anybody. I have band 5, 6s and 7s sign me off. It's whoever's free at the time to do a peer review or to come and watch me.
Okay, thank you.
We're out of time, so just thank you very much to all our speakers, Rob, Millie and Laura, for joining us this afternoon. Thank you.